Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Welcome back to the show. Renae Tramonte joining us here today, and she's the owner of Indigo Dove. We're here to talk to her today about her work and services as a clinical social worker that she does. Welcome to the show. How are you?
Good. Thank you for having me.
Well, pleasure to have you here. I know you're based out of Long Island, right? Baldwin, New York?
Yes, ma'am.
Beautiful. And we have something in common. I'm in Suffolk County, but close by. So we're practically neighbors. Would love to find out more about you and what you do as a clinical social worker specialist in Belmore.
Okay. Baldwin. But yes, I did have a
Oh, I'm
practice.
sorry.
for
Well,
a
the
while.
second
That's
part, it says Belmore. The first part said Baldwin. So I'm like going with the flow.
okay. Same letter, no big deal. Well, I have been in a providing role for over 20 years. I've had a private practice about 17 years, alongside working a regular job in clinics. And I recently opened up Indigo Dove Therapy Wellness to address the issue of access to mental health, and in an attempt as a small business to get help to as many people as possible. So we're fairly new and here in Baldwin and doing the best we can, but there's issues that need to be addressed for sure.
Yeah, well, we would first and foremost love to find out more about you and what you do. Tell us where you grew up and what brought you into this field. And also, how can we contact you?
Okay. Well, the contact would be contact.indigodove@gmail.com.
Okay.
I grew up in Belmore, and what led me to social work, quite honestly, I have no problem discussing it, was a very traumatic childhood. And sometime in high school, I finally got in touch with a social worker who finally tried to help. Unfortunately, it was not successful, but I had to go down other avenues and do the best that I could to try and thrive. I didn't get to go to college till I was a little bit later on in life, but I think that social worker is what drove me into going, along with my childhood experiences, into going into this field. And it has become an absolute passion for me to do this work. It's so important.
Beautiful.
I've
Well,
been treating drug and alcohol and mental health issues
oh,
for
that's what I was going to
20 years.
ask. What is your specialty?
Mental health, drug and alcohol.
And you work currently, specifically, do you work from only Long Island? Are you able to see clients in other states, or what is, and do you do
Well, it
Zoom or
depends on
in-person
the insurance
sessions?
companies and what they'll allow, but we do telehealth. There's, aside from myself, there's 8 other therapists here.
Oh,
Thank them. Shout out to the team because they're doing the best they can to get mental health services for people who might not have gotten it otherwise.
mm-hmm.
And Indigo, it does not discriminate and about which insurance companies or which plan. We take as many in as we can without trying to keep the business going. So there's some issues again in that department as well.
Great. And how can we find you? Is there a website or any type of social media contact page that we can have people reach out to?
Actually, no, because websites are expensive and we're still pretty new.
Okay.
And that is a hope for the future, along with some expansion. I'd like to open up a couple new locations to increase the ability to address the mental health issues that are rapid in this country right now. And so right now people find us by doing a Google search, and our main phone number is 516-220-2244, or they could email contact at indigodove@gmail.com.
Perfect. Do you want to
And
share your
also Psychology Today.
Okay. Do you want to share your thoughts on mental health right now? What's happening in the world? Any, things that you're seeing? I mean, I feel like I've heard a lot about mental health since the pandemic. I felt like it's becoming a lot more well known, even though I think all of us had mental problems our whole lives. It was kind of shunned away from. And then I feel like it's becoming more acceptable to admit that we do have problems and it's okay. What is
Absolutely.
your take on mental wellness?
Um, I think that no one gets off the planet alive and without some kind of issues that concern mental health. Honestly, I want to give a shout out too to some people in the public eye bringing more attention to this. Most recently, October 10th was National Mental Health Day, and shout out to Carson Daly and the Royals there bringing some attention to it through their work. But there's so much more that needs to be done. So much more. I like to talk about my passion, which is getting access to mental health, if that's okay
Sure.
with you, Joe.
Absolutely.
So the first thing that concerns me is that for the average person, the typical plan cost for insurance is $7,000 to $10,000 a year with unreachable deductibles. So
Mm-hmm.
a lot of people can't afford health insurance or have to pay so much that they don't go looking for the mental health they need. And it would be wonderful if everyone had access to mental health um, treatment, but I want to talk a little bit about the insurance companies. I'm
Sure.
not pointing out any particular insurance company, but I think that's a big block to people getting the help they need because there are not, there's a disparity between the plans and who can get help and who can't. So we try to take every plan that we can. We take Medicare, Medicaid, and what happens is that because there's a disparity in what's paid by the insurance companies, um, the unfair payments and the disparity in the difference of what they pay from one insurance company to another,
Mm-hmm.
uh, with more people not being able to gain access to mental health. It's not a well-paid field to begin with, and social workers do a lot of the care,
Mm-hmm.
but a lot of people end up dropping out of the panels because of the unequal payments. They drop off, or they just don't take the lower paying insurance companies, which again ends up with more people who need mental health services not being able to get them. In fact, they have difficulty getting on the panels. It's a long, drawn out procedure, and then they put you into a contract that caps your payments.
Mm-hmm.
So, or they tell you that they're saturated in your area after you go through the process, so you can't get on the panel. So I've been on the panels here for, I don't know, over 15 years. And there are still some panels that haven't raised their payments
Okay.
in all these times. So then what happens too is people, if a client, they also have service codes. So an initial visit is a different code to the insurance company, and then an individual session varies. But if a person, for example, comes in and they're very distraught that particular day,
Mm-hmm.
and they run over the allowed amount of time, and we have to bill out for a higher code, the difference is literally by minutes. So nobody makes a session that's 38 to 52 minutes. So if you do 53 minutes or over, you bill for another code, but then you run the risk of the insurance company saying,
Denying.
denying.
Got it.
Okay. And that makes it more difficult for people to do it. And when people can't afford to take care of themselves, mental health, I've seen it. I've been out here over 20 years. What do? They self medicate. Now you're talking about dual diagnosis, mental health, drugs, alcohol to numb the pain.
Yeah.
And that just breaks my heart. It just really upsets me because it doesn't have to be that way. I'm sorry.
Oh, no, I,
Give me
yeah.
a sec.
And I'm sure
Uh-oh.
you've seen your fair share of friends,
I mean,
family, clients, right? Going
pain
through
and
this.
suffering, and it doesn't need to to be there. Treatment, goes way beyond the initial session too. Oftentimes it's a crisis meeting or something happens, and a lot of therapists are allowing themselves to now, because of different technology, you get a text, you're texting back a client on an off day, or something happens, or if they need a session right then. And then there's a barrage of paperwork that's expected from us, and of course notes and text and so much more than just people seeing what they see on like a TV show where you're just sitting and talking and that's it. That's all there is the job, because it's far beyond that, because sometimes we have to connect them to other services
Mm-hmm.
or other places where they can get some of the help outside of the realm of their mental health and make those referrals and write letters and school kids, and it's there's a lot going on.
Now, just wanted to know if you would be able to share some without using any clients' names, but Some of the things that you're seeing more uptick in trends with the mental health world. I know you mentioned drugs, alcohol, but is there something in particular that you wanted to shed light on that could resonate with our viewers and listeners?
Well, there's a lot of different possible diagnoses, but what I see the most of is heightened anxiety and increased depression, and a
Okay.
lack of access to prescribing providers.
Okay.
Again, for the same reasons, because they feel they're not being paid their worth, they don't provide the services. I've seen some people who can prescribe bill from $300 to $1,500 just to get their medications, and that shouldn't be the case. So that goes back to the insurance companies and what they're willing to pay. And I think that the providers need to unite and not compete.
Mm-hmm.
And if we all got together and said, hey, what would happen if every single provider said, I'm not taking insurance? No one's getting help. People have health
Mm-hmm.
insurance because they need it. It
Mm-hmm.
needs to be affordable. The healthcare should not be a stock option.
Yeah.
Health. So we need to kind of revamp the system and how it works. That some of the CEOs are making between 2 and 4 million per year, while there's millions of people out there who can't get access to mental health treatment. And then not to mention the billing issues, constant denials, very hard. You can't get someone on the phone.
Mm-hmm.
Constantly ask, I can speak to me personally, but I'm sure other providers. Every month I'm getting asked to go online, reattest that I'm still on the panel, which I understand they need to do. But we need like one central for the state
Yeah.
portal where we could get all our information, our EOBs, the explanation of benefits.
Benefits. Yeah.
It would make sense instead of having 15 different portals that I have to get on every month to have one generalized
Yeah.
place to go to take care of those needs and reattest. We did have that going back 15, 20 years, but it's changed and it becomes a lot. So the billing issues with the constant denials
Mm-hmm.
are very hard to get someone on the phone. The issues cost providers time and money to kind of get their claims paid. And guess what that comes down to? Seeing less people
Yeah.
because we have to do it, or it costs us to have to pay a billing company to
Yeah.
handle it. So that's another deterrent for more people getting help. And then sometimes if they do have an insurance or if they change the job, instead of the insurance companies communicating with each other, they put it on the person who needs the mental health to contact them due to this something called continuity of benefits. So if you had insurance company A and now you have insurance company B,
Yeah.
they don't communicate. And now the person has to get on the phone, call their insurance companies, wait on hold for a long time. And in the meantime, they've been seeing you, and all of a sudden there's a lapse in when they pay, which I understand because it takes a
Yeah.
lot of process and workers and whatnot. But I'm sorry, I just got distracted for a second. So what happens is that you're spending all this time trying to get through the billing and
Yeah.
trying to have the clients call, and then the provider's not getting paid. So a lot of providers drop off the insurance companies, which I understand because they're not paying the value of the work and the degree that you've been doing it, that you're
Yeah.
providing the services. So again, time spent here in the billing um, is less patience, less time, and less care received. Or they just stop coming because if there's an issue in their mental health provider insurance, they just don't come. They give up.
Mm-hmm.
That's terrible. No one should have to say it's because of that I can't get the help that I want.
Yeah.
So there's just a lot going on here. A lot going on here. And when you're a small business like myself, well, the aspects of necessary, some
Mm-hmm.
necessary, some not, hurt the small companies trying to provide. And then there's other places that are so large that, and I've had these clients and I've worked in some of these places, complain that when the therapist burns out and leaves that company, the patient just gets switched to a second, a third, a fourth, or more providers. So
Yeah.
it's starting the process all over again to some
Wow.
degree. So we really need to have a understood, clear-cut way of getting the mental health access without
So
all.
who do we reach out to advocate for this? Where does it, where does it stem from? I mean, should we be who could we contact to
Well, I think we
lobby in a
need
sense?
to
There's
put
this.
the mental health providers have to come together, and we have to address all the different aspects, but it starts at the insurance companies. And if you make everything easier to access, more people will get help. In the meantime, in my career, I've seen so many deaths and so many hospitalizations and so many people who can't get access to their medications and drop off, or sadly, a number of suicide cases.
Mm.
And that's the ultimate payment for not being able to get the mental health care. And that should not have to happen anywhere, ever.
No.
And it's also unfortunately become very common in our schools, in young children with depression and anxiety.
I was just going to ask you, there has been a rise and uptick in
That
younger children, right? I mean,
I can't give you a number because
oh,
I'm what's the word I'm looking for? Statistic
statistic.
person.
Yeah.
Thank you. But I can tell you just from experience
Uh,
over the years that it has to have gone up at least 50% or more.
wow.
You have 5-year-olds, 6-year-olds suffering with depression. No child that age should have to have depressive issues.
No.
That's supposed to be the beautiful part of growing up, not the burden.
Yeah.
Burden. I'm disappointed, and I think that things could be better and things could be different. And like I said, with people like Carson Daly coming out there and talking openly and freely, and all the other people in the public eye, oh, that's helping, because
Yeah.
we're trying to take the stigma out of having a mental health issue.
Yeah.
They're still there. I don't care who says it's not, but there's still a stigma out there, and people need to be okay and feel safe to reach out for mental health.
Got it. Well, any suggestions or recommendations what we could do to help increase our mental health and wellness at home on a daily basis? Do you have any suggestions for those out there today, maybe listening in need of mental health care that they haven't reached out yet, or what could they start
Well,
doing?
first of all, I would tell them that, do not be afraid to reach out. Keep reaching out.
Mm-hmm.
I have had more calls that I can tell you where I pick up the phone, or I answer the phone, or I call them back, and the people have burst into tears because someone has called them back, because we're inundated with the amount of providers versus the amount of people who need the care. So we need to have equal pay for equal services across the board for the insurance companies,
True.
that providers aren't dropping off the panels.
Okay.
A lot of people cannot, I understand why they do it,
Yeah.
but we as providers need to be able to make our way financially in this world,
Yeah.
but it shouldn't be an issue of somebody getting mental health. If we had some kind of a system that treats mental health and pays everybody equitably.
Can I give an example?
I have Lisa with me.
Hi, Lisa. Is she one of the
Hi, Joe.
therapists?
Lisa's an
Hi.
admin person here, part-time, because we're a small
Okay.
business.
Okay.
If you can afford to have a full-time, I'd
Jill,
love
I
to.
just want to give you a little example.
Sure.
I received a call last week. A mom, her son is 27 years old,
Okay.
and he has a tremendous amount anxiety, financial anxiety. You know, the healthcare in our states is just it's non-existent for 26, say, to 35-year-olds who are no longer on their family plan,
Mm-hmm.
or their company doesn't, can't afford to give them the insurance.
Yes.
So they're literally going without health insurance.
Sure.
Okay, because if
can't
they
afford
buy into the system is, and it's basically all of them, anywhere between $500 to $800 a month. But here's the icing on the cake. A 26 to a 35-year-old paying this $500 to $700 a month, but on top of that, they don't have insurance until they pay their $7,000 to $10,000 copays.
Mhm.
So now they could be paying all that money and never actually use their insurance.
Sure.
So I have a mother, and I told the mother I can't speak to her, that the son has to call me because of his age,
And hip.
because of
Yep,
HIPAA.
yep.
So he did call me. I cannot tell you the thankfulness
Mhm.
that we received. I even got an email
Aw.
thanking me because nobody returned their calls.
Yeah. And it's not the provider's fault. It's just
We're
overwhelming
inundated.
numbers.
We're getting
Mhm.
so many calls a day. And I, like Renae said, you're talking 5-year-olds, mothers calling about their 5-year-old daughter who's depressed. Like, what
Right.
5-year-olds are depressed at this
What
age?
what is
Yeah.
going on? Yeah.
What is going on? Now, I truly do believe that COVID had a lot to do with it because
Yes.
they weren't out there with their friends and doing
Mhm.
5-year-old things.
Yeah.
But there comes a time where, they need help. And I honestly do not understand where insurance companies make the final decisions on who receives the help.
Mhm.
That should be the provider's decision.
Yeah.
Good point.
Well, a lot of companies actually hire people to look at the claims to validate them. I'll give you an example. Medical health. I have a patient, she's a nurse. She has very bad pains. I don't remember the exact thing and problems with her legs. And she
Okay.
for years suffered and high levels anxiety. And
Mhm.
been working with her for a while. She's gotten a lot better. Recently, she had to get a surgery. And the day before her surgery, the insurance company denied it. Her doctor resubmitted twice. And by the time she got the surgery, she was upset. Some of the work that we had done in regard to her managing her anxiety had gone out the window because she's in pain, and she's upset because she tells me, and I'm going to quote her, I went from, as a nurse, hero to zero. And she's on her legs and a surgical nurse on her feet all day. So this is not what you normally hear about. There are things a person can do at home, and we've all talked about what is the term for it today, and I'm a little old school. Mindfulness, which is basically comes down to what it's always been, is conscious awareness, being able to be present in a moment. So yes, those skills of meditation, relaxation, certain reading certain books and self-help things help, but it has to be in turn with a licensed therapist. So something else that we're doing here is we're trying to help the new people coming into the field be the best possible professionals they can. So I take interns from schools that come in and they're trying to help. I even have a local school that has high schools coming here to just be here and experience what it feels like to be in the office. Of course, they can't see
Yeah.
patients, but
Wow.
they want to go into this field, and I want to encourage them to do that.
Well, thank you. I mean, for bringing more awareness to this situation. You've definitely enlightened myself, and I'm sure a lot of listeners out here about these struggles. And as a mom, as a patient, as a person, human, you go in, you think you're getting the help, and you don't realize what goes on behind the scenes like this and all the
So much more.
frustration. So I appreciate. I'm sure there's a lot more, and I know we'll get to it. When we get to speak again. How did you want to kind of summarize up today? And we have to remind everyone how they can reach out to you, and really start advocating for this. I really hope that mental health professionals do start getting together and unite
That's the
on this
only
front.
way that
Okay.
things are going to change is and I think the reason why people don't unite the way they used to is because everyone's so busy just trying to keep
Yeah.
up the day and do their job and have their family and pay their bills, that it's just, let me just push through one more day, and before you know it, 20 years have gone by and things aren't changing. If anything, they're not getting better, and it's very sad to me.
Jill, if everyone had access to this care, the world would be a much better place.
Absolutely.
If they just had access and let the providers do what they were trained to do,
Mm-hmm.
instead
Can
of
make a
putting everything
difference.
about the almighty dollar.
Yep.
There's so many middle class people that can afford health insurance.
Yeah.
So they're the ones, and they make up a majority of our economy. They're
Mhm.
the ones, they're our population, and they're the
Yeah.
ones who aren't able to receive the care that they need.
It's true.
Got
Sure.
it. Well, thank you guys for being here. Remind us how we can reach out to you directly, please.
Okay, contact.indigodove@gmail. And our phone number is 516-220-2244. And if we don't pick up, please leave a message for a call back. Give us 24, 48 hours because we are inundated, but we are making our absolute best interest to help as many people as we can. I'm looking to take on a few more therapists if I'm, God help, able to expand, open up a couple of new locations and take as many insurance companies as we can and not divide between the disparity, because really, who gets to decide in our world
Yep.
whose mental health is more important than another person's? And I'll say that's not true. No one should
Absolutely.
be absolutely equal. And if we, like I said, leave a message, because I can only afford to have Lisa here a few days a week, and I would love to have her here every day a week.
Aw.
But
Well,
the
thank
goal
you.
is to keep us up and keep us going. So thank you again for having us.
Jill, you can also find Renae Tramonte on Psychology Today,
Mhm,
and her staff is also there. So you
Okay.
can chat to us that way.
mhm.
And Indigo Dove is INDIGODOVE.
Mhm.
So it's contact.indigodove@gmail.com.
Perfect. Thank you guys so much. I appreciate that. Looking forward to the next time we get to speak. And thank you again for being here and bringing a lot of this to our attention. And thank you.
Thank
Thank
you for
you.
having
Have
us.
a good day, ladies, and we'll talk
Yeah.
soon. Okay. Hopefully
All
next
right.
week. Thanks
Sounds
so
good.
much.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.